So hello and welcome everyone. Good morning. Welcome to this exciting webinar that we are running jointly with Evosys. My name is Bilal Abdah and I'm a part of Oracle's team in the Alliance Channels organization. I work as the go-to-market leader looking after data management, analytics, and emerging technologies pillar across the region of East EMEA. And today we have a very exciting webinar for healthcare providers that shows the value of data and analytics in the healthcare industry. And I would like to start by shedding some light on the latest and upcoming trends with a brief outlook on what the healthcare industry will look like from a technology perspective. And then I will hand over to our colleagues and friends from Evosys, to Arpan Makawana. He will introduce himself after this session. But before we get started, I would really like to shed a little bit of light on how do we perceive the healthcare industry moving forward with this seismic change that we are currently facing. So moving on past the safe harbor statement. Okay, so to get started, healthcare is undergoing a major transformation in a lot of areas, right? Fundamentally, these changes, these transformation are happening to improve patient outcomes. This is the major goal of these transformations. And there are a lot of areas that include impacts coming from the current COVID-19 pandemic that we're actually going through. For example, it's like rising per capita costs, consumerism, regulations and interoperability, changing the view of healthcare, right? Changing the view of health in general, clinical satisfaction, as well as digital transformation. Now, we can decompose all these in more detail and focus, and put our focus and look at some of these areas and what we can expect in the future. So we have many subsectors across healthcare that will continue to see substantial growth led by the explosion of virtual care and digital health. And we have specific sectors that present opportunities in telehealth, in home telehealth care, in digital health, value-based payments, patient engagement, as well as interoperability solutions, right? And we have a lot of market projections, as you can see from the this is, by the way, only for information purposes, but you can see the projections that we have. For example, in the terms of healthcare, we see that currently the global market is valued at 25.4 billion. That was in 2020. And up until 2025, we expect that this number will reach to more than 55.6 billion, right? So, and we've noticed a lot of the healthcare providers are providing virtual care, right? Especially during the first couple of months in the pandemic, that was a very high trend among healthcare providers. We also see other numbers that are also affecting the home healthcare market. For example, it's expected to reach 515.6 billion by 2027, right? And you can see from a digital health perspective, the market was valued 2 years ago at 111.4 billion, right? And it is expected to multiply 5 times to reach up to, more than 510 billion by 2025, right? So you can see that, the seismic events is completely changing the landscape. The market size is changing drastically, right? We have new trends that are coming into the picture, and healthcare providers are spending more and more money into that areas, because this is basically how we see the transformation happening to handle this disruption in the future. So looking towards 2025, we can group many of these trends into 3 major categories. We have our health, our view of health is too narrow. Only 10% of our health is actually a result of medical care, as indicated by the graphic, right? But the costs are actually too high. Why? Because the rise of value-based care and waste inherent system. And we have consumerism that is evolving highly. As I mentioned, we have the virtual care system, we have the interoperability, and we have patient experience. These are among the top priorities that we have in terms of consumerism. And the quadruple aim, right, is more relevant than ever. We're continuing to evolve from the original triple aim. And if we want to speak a little bit more in details, our view of health is too narrow. Only 10% of our health is actually the result of the medical care, right? We need to have the holistic view of the patient. We have the population health, what we call population health 2.0 right now, which is evolving towards enabling 360-degree view of the patient. And this is very important because we need to capitalize the best platforms that are capable to leverage the genomics, right, the clinical and social determinants of health. Hence, we're partnering with companies like Evosys, trying to build this kind of, let's say, modernized data warehouse that has the 360-degree view of the patient, and then providing high-value insights on top of it. And this is something that Evosys will put focus on. We're also trying to shift to well care, because healthcare moving beyond the traditional sick care. We're trying to emphasize the programs that promote well care to keep people healthy and engage over long term. And we also look at the precision medicine, where each patient's unique genetic makeup coupled with lab tests and other data is being adopted into a clinical workflow, enabling earlier intervention and treatments tailored to that individual, right? So we're doing more tailoring, more hyper-personalization on the medicine, on the medicine and prescriptions itself. We also have the aging population, right? As the population and workforce ages, there will be a need for elder care and curated pathways based on outcomes, benefits, costs, and risk data shared freely with the individuals, right? Before leaving the choice to them. Remember that the costs are still too high, and the rise of value-based healthcare was waste, right? And it was inherited in the system. We have alternative payment methods and alternative payment models. This slowly shifts away from free for service towards quality-driven value-based payment models. This will continue as payers look to improve the outcomes and reduce cost, right? We also have the care coordination that has increased emphasis on integration cost hospitals, right, across all the hospitals, and a health system and regional systems that will grow in order to better coordinate care, share supplies, equipment, and also balance capacity. We have the outpatient care, where we have increase in treatments and procedures offered through less expensive care settings and move care to the home with remote patient monitoring with the rising technologies of IoT and so on. We have supply chain, introduction of best practices from other industries, such as the demand and supply, the planning, the costing, the budgeting, which can be applied in healthcare, right? And the way that consumerism is evolving through virtual care, through interoperability and patient experience, these are the top priorities where we have the consumerism, where in the virtual care, we have new types of reimbursements. There is a high demand for care. There's a shortage of clinics and accessibility. This is all driving the growth of the virtual care. We have the ability to harness the data, which will help clinicians detect patterns to better manage the patients. And we also have the care convenience, where the providers are moving closer to the patient with services, like, for example, the urgent care, the surgery centers, the transfusion centers that used to be found only in large hospital settings. This is not the case anymore. We also have the patient experience with top priority for most providers that involves new patient engagement strategies, even when the patient is healthy, by the way. Okay, and we also have interoperability, which means the adoption of FHIR standards and government policy that will enable the exchange of clinical data, resulting in, number one, transparency, and number two, elimination of redundant testing, and improve how hospital care for patients regardless of the application or the vendor, right? And we also have the security and privacy, where cybersecurity comes as a top priority, and PHI, to note that HIPAA is not a certification, but an attestation of compliance. So BAAs are typically requested by US companies when clinical data is stored in the cloud. Okay. This then leads us to the set of short-term priorities, right, as a result of the pandemic. Clinical shortage, patient overload, stay-at-home policies, and rising unemployment are all driving this change. This impacts, it drives us, and we fall into 8 categories that we're already seeing today as we speak. The graphic on the right shows one of the biggest problems as exposed by New York State, which is completely disconnected health system with a lot of silos. We have moving patients and their clinical history. We need sharing resources. We are competing with other states for supplies. All of this is broken, right? 2 new interoperability rules issued by the HHS and CMS, which is implement interoperability in patient access provisions for the 21st Century Cures Act, right? And the support that the US government has done in the, for example, My Health ED Data Initiative. We have similar initiatives even running in this region as we speak that are designed to give people access to the medical information. And basically, we're just waiting for the rollouts to be official within the coming few years. But the rules are in place right now, right? That's why we're trying to look for future, let's say, for the outlook of how this will impact the costing, the new revenue, right? The increasement of, for example, enrollment for health surveillance and so on. What we're trying to do in Oracle is that we're trying to bring a robust and unified platform based on the cloud for healthcare with all the services that's required, starting from IaaS to PaaS to SaaS, right? And partnering with partners like Evosys that have the capability to bring this footprint into a broader and deeper perspective and then build the solutions on top of it, right? And they utilize the portfolio from cloud solutions. They enable process optimization for multiple business units of healthcare providers, like, for example, finance, HR, supply chain, workforce planning, etc. And in Oracle, we also offer the capability to enable a unified view across the health system and provide service line profitability. And then we have, for example, partners like Evosys who take this and transform it, translate it into reality, like, for example, what we will see today in the healthcare analytics solution that Evosys has developed. And Oracle Analytics Cloud with Autonomous Database are innovative offerings in the cloud that are proven to reduce the operational cost significantly. And we are here with Evosys to demonstrate this. The healthcare analytics solution is very vital, right? Because this type of solution spans health data platforms, pandemic response systems, clinical research, health insurance applications, a lot of data sources where we, break the silos and we have a single source of truth. The platform is created for operational excellence, for continuous improvement and innovation. Okay. Now here we have a portfolio for let's say for healthcare providers across different swim lanes for care, delivery, supply chain, cost of care, right? Also listed are the horizontal capabilities for finance and HR, as well as regulations and interaction with other systems that we also take into consideration, right? But I want to shed a little bit of light because I think this is something that will be covered today by Evosys, which is the costing perspective, the data management perspective, the budgeting, right? And these types of areas that are of high value to healthcare providers. And we also have the portfolio for healthcare payers across different swim lanes, from a market review, from a planning development, from activation processing. And we also have the horizontal capabilities for finance and HR, as well as regulations and interaction with other systems that we take into consideration. Okay. Now, the purpose of this slide, again, we have a lot of reports that come from entities like, for example, Gartner, from MIT, and also from Oracle, right? But it's very important to establish the value as we're trying to help customers drive the transformation to achieve operational excellency. And I think you see from the numbers speak from themselves of how much value, let's say, foundations in the healthcare industry can really obtain in terms of the investment that they're doing. Now, we have a lot of customers in the region that basically utilize the Oracle Cloud portfolio for healthcare, but I'll not talk about these references. I will leave it now to Arpan and the Evosys team to go through more details and show you examples, real life examples, and go through basically a live demo and describe the healthcare analytics solution that will basically enable you, let's say, to have the maximum ROI, enable you to shift forward with a future-proof solution that is based on the latest and innovative Oracle technologies. Thank you very much. I hope you enjoyed this session, and handing over to you, Arpan. Yes, I can see your screen, Arpan.
Okay, great. Great, thank you. So I'll quickly introduce myself and the organization. So I'm Arpan Makwana, and I'm heading the innovation practice for Evosys globally. And healthcare is one of the key areas where we focus, and where we've developed solutions that can help organizations to improve the quality of care, reduce the cost, and also improve profit ultimately. So these are the three main areas that I'm going to focus upon. I've got a great demo to showcase today. I'll be running through the demo, and we'll see how these different KPIs are met using the solution as well as the consulting service. I'll go into the company's introduction quickly. So we are a global organization. We started from Middle East and then we spread across different regions. So we are pure play Oracle partners, and we implement all Oracle solutions that are available in as part of the Oracle's portfolio, which includes ERP, EPM, business intelligence, then solutions which are vertical specific like healthcare or public sector organizations or even logistics, transportation. So we implement these kind of solutions for our customers globally. So we've got more than 1,200 customers on cloud across the globe, which gives us good amount of exposure and understanding of how different organizations do their business across the globe, and what are the important KPIs by function or by business vertical that we can quickly get on table for our customers. We've also done a lot of work on healthcare. So in terms of healthcare, we've got more than 150 customers, which include public sector as well as private sector organizations. This is a quick landscape. So we've got more than 1,500 consultants as of now. Again, all of them are 100% Oracle focused, and that's where we get most of our strength. So, as I mentioned, these are all different solutions that Oracle provides, and we implement these solutions for our customers. The important part here that I want to focus on is that, as I said, we've got more than 150 healthcare clients so far, and we've got a great team who can implement solutions like these. So we've got physicians and doctors on our team who understand the healthcare environment very well. We've got chartered accountants and CPAs who understand the finance side of the business very well. And then we've got application experts who help us to implement the solution in the right way with the best practices, picking up from different places that we've implemented so far. So the solution that I'm going to talk about today is going to be specifically around quality of care, cost saving, as well as improving the profitability, as I mentioned. So how do we do that? What are the important areas that we should focus on? So as a healthcare organization, when I start doing my analysis, when I start doing the analysis of different departments, like clinical departments or support departments, that's when I need to understand which are the problem areas where I can start focusing on, or which are the areas that can help me to improve the overall profit at a gross level. So I need to focus on those areas. So the first question comes in when I say that, where should I start focusing on? Because there are huge number of applications, there are so many business units or departments in the organization. Where do I start focusing from? So the solution is intelligent enough to help us identify the right areas where we should focus in terms of, let's say, cost leakages that we see, or in terms of the potential increase in the profit that we would consider. So those are the areas that the system or the solution directly highlights, and that's where we can start doing our detailed analysis, like what is the cost by patient, what is the cost by service, or what is the profitability that we can get by different business units. So these are the type of analysis that the system helps us to do. So what we intend to do here is focus more on our business rather than learning the application, and that's where the application is intuitive, and it helps us to derive the right KPIs from the quality or from the cost perspective. So we've seen a lot of organizations struggle with managing or maintaining their expenses or their costs. So how do we make sure that we are competitive in the market? How do we increase our market share? How do we provide service to our patients who seek great medical attention? How do we make sure that we serve the patients, or we improve the health of the patients without compromising on the profitability or without increasing the cost of operations? So these are very important areas that come to mind when you look at overall healthcare organizations operations. So I'll quickly skip this. We can share these slides with you so that you can go through it. What I want to focus more on is how do we make sure that all these different KPIs that I just spoke about, we get those quickly from the application, right? So I will. These are the three important steps as a part of the implementation. First is trying to build the cost model, making sure that all the right elements are put together to create a right cost model. Implement that on the set of tools that we get from Oracle, and then do the detailed analysis of all the data, whether it is clinical data or financial data or quality of care data. So we get all this information onto a common data warehouse, and then we start doing the analysis. So this is a very important journey for any organization. So let me take you to the demo first, and then I'll show you how we build the cost model. I'll switch to the demo instance. So here, this is the healthcare analytics platform that we have developed on Oracle platform, and you can see there are a lot of different tabs or icons available. So I can do, as I mentioned, I want to understand all different types of KPIs throughout the organization. So I can have a separate KPI dashboard that can be grouped by different subject areas, or that can be basically grouped by different specialties or clinical or support kind of work areas. You have financial analytics, then we've got supply chain analytics. Similarly, we've got volumes and trends. So how do we make sure, or how do we get the insights into the volumes of the patients or volumes of services that the organization is driving? So how do we get those, and are these volumes sufficient enough to drive profitability or to control our expenses? So it gives us good amount of insights into volume and analysis. It's not only about the existing or the real or the actual data or actual volumes. It also helps us to do the right forecast. So the system gives you the capability to do the right forecast for all your inpatient, outpatient, as well as emergency kind of patients, which give you the platform to understand what kind of resources would you need from the facility or equipment side, from your manpower side, as well as from your financial perspective. So it helps you to build the right budget. It helps you to identify the right areas where you need to expand or where you need to contract in terms of your resources. So apart from that, you can see productivity analytics, which is again a very important area for healthcare, because that's where the system would be able to tell you how productive a particular department is. How can you compare that with the local benchmarks as well as the international standards? Similarly, if I want to see what is the productivity of a particular department when you compare it with the last few years, so you can do a comparison in like an introspection within the organization with the historical data, or you can also benchmark yourselves against the local as well as international standards. So how do you benchmark? What are the important parameters? So that's where our team comes into picture, saying that we've got a standard list of all the KPIs, more than 500 KPIs, I would say, as of now, which are like pre-built KPIs as a part of our healthcare analytics dashboards. Similarly, we've got pre-built benchmarking data saying that, okay, whenever a patient comes in for, let's say, knee replacement, how many number of bed days do we assign them? What are the kind of tests which are required? So we have a proper clinical pathway. So this clinical pathway is very important for the organization to follow, to ensure that there are no rejections from the insurance payers, and there are no cost leakages, and also to make sure that we are driving right profitability from the overall business. So that's where productivity basically connects with all other different factors. So let me try to focus more on the profitability and costing part. I'll go into the detail. So here again, what we are doing is, sorry, it was idle since a long time. So let me log in again. So what we are doing here essentially is trying to connect all different pieces of the healthcare organization. So we are trying to connect the supply chain with the manpower, with the financial data, and also getting the clinical data in picture. So all this data put together will give you meaningful information, making sure that you can drive right set of KPIs for the organization. So if you can see here, this is my primary dashboard that I've created here. I want to see the uh, parameters. So these are different parameters that I can pick. Do I want to see it by cases? Do I want to see it by average length of stay or charges or revenue? So I can pick up any of these parameters, and the data will automatically align uh, against this parameter for all these different charts here. So here it shows me the average length of stay by all different types of specialties or departments. Similarly, I can see these are different facilities across the region that I can compare vis-a-vis with. And then I've got these insurance payers. So these are different types of insurance payers that contribute to most of my revenue for the organization, for the reimbursements. I can do my analysis right away on this dashboard, or I can drill down into the details trying to understand what are the right insurance payers that I should focus on and renegotiate my rates with them. Similarly, it also gives me a clear picture in terms of the bad debts. or the rejections that we get from different insurance payers. Ultimately, those are bad debts because we are not going to get reimbursed for certain services that are rejected by the insurance payers, right? So we want to focus there so that it helps us to build the right cash flow. So here, as I mentioned, there is a lot of potential to do different type of analysis by department or by facility or by insurance payer. What I want to get to is when we negotiate or renegotiate our rates with the insurance payers, or even when we try to build the right clinical pathway for any of the services within organization, what are the important factors that you should consider? How do you benchmark yourself with the local as well as international standards, right? So those are important areas that I'm going to cover in the next few minutes. So what I'm doing here is I clicked on the profitability tab, and I've got all these different parameters if I want to do my analysis on a specific data set. But then I go down into the details. I can see again what is the profitability or the net margin that I have by different departments. Some of the departments are loss making, some of them are profitable. So we want to go down at the lowest level, saying which are the services which are not profitable at the most granular level, line item by line item. Similarly, which are the patients which are not profitable? And not only that, we also want to understand why are they not profitable. So identifying those loopholes or cost leakages, and also making sure that we try to find the root cause and eliminate those cost leakages and problems in our in our overall organization. So those are important areas. So if you can see here, I have a set of all these different data for all different departments. And if you can see the columns, I've got the number of cases, the case mix index, similarly the charges, revenue, and then you can see the margin. You can see the remaining reimbursements that are open or pending from the insurance payers. And then what would the overall net margin. So I have a way to pick up all these different types of parameters or the different types of columns, and I can create my own report. What I want to focus here is this is basically by department. I have a way to split this into different subgroups. So when I go here, it tells me this is the combined data that we just saw. Then this is the inpatient data, this is the outpatient data, and the emergency data. So you can clearly see what are the kind of service volumes that you are getting in each department, again split by subgroups or subcategories. And I have the capability to go into details as well, which I'm going to show you now. So I want to, from here, I want to drive into details saying that, okay, what is the overall cost per service, or what is the profitability by service. So I want to drill down from here till that level. So before I go there, I want to quickly put up uh, a poll, a question, in terms of what are the challenges that you currently face in the organization. Is it managing your costs, or is it profitability? So what are the challenges that you face in the organization currently? So I'm just launching this poll. Let me know. So once you log in your responses, then I will immediately go back to the demo. So I'll keep it open for another 10 seconds. Okay, great. So I'll close the poll now. Thank you for the responses. Um, Now I'll move forward. As I said, from here, I want to drill down into the details. So, at any point in time, I can drill down into any of the data that is available on my dashboard, and then see the granular level of details, which may. So if I go down into details, I can see these are all the encounter reports. So I can see these are the DRGs or the packages that are available. And then these are the number of cases by each of these line items. And then you can see all other different parameters here. At the end, you can see which of these services are profitable and which of these services are not profitable. So how do we identify these services, or what is profitable and what is not? So it's important that we allocate all the cost from all different departments, like indirect departments, support departments, or corporate departments. So we want to allocate all those costs or expenses down to the lowest level. So when you allocate all those expenses from the topmost layer to the lowest granular level by service or by the patient, that's when it will give you the accurate information saying that these are the services which are not profitable. And it will also tell you where are your costs being inflated. So if I go down into the details here, I'll pick up liver transplant in terms of the data usage here. So you can see I have all these different patient details, all the patient IDs, and these are 17 patients for liver transplant. And you can see this is the total charge quantity, the total bed days, the revenue, costs, and then you can see what are the margins here, the net margin which is available. So at any point in time, I can go down into the details here, saying that I want to see what are the charges for this particular patient. So here I can, if you see this, these are the total number of charges. I'll just drill down into this. So 9,000 charge quantities. So this is the patient that I drilled down for. So this patient, so many services given to this particular patient. So consultation, lab, and then you'll have the pharmacy or medications, OPIP procedures, rooms and boards, radiology. So all these have been given to this particular patient. And then it also tells me that what was the charge, revenue, and what was the overall total cost. I can drill down at this total cost level as well. This should be able to tell me how much is the what is the breakup of all these expenses. So for example, what are the salaries, what are the professional fees, medical supplies for this particular service for this patient. So it gives me a full breakdown or a detailed breakup of all the different types of expenses that are there in this particular cost. So I agree, we don't want to compromise on the treatment of the patient. We don't want to compromise on the medical diagnosis as well as treatment. So how do we make sure that any complicated patients that come in, we don't consider them as a part of this standard benchmark. So there is a machine learning algorithm built within this application, which automatically identifies the outliers. So when I say outliers, these are the exceptional cases, or these are patients who come with comorbidities or who come in with additional infections. So we cannot count them as our standard operation. They have to be considered as exceptions. So the system has that machine learning algorithm which automatically identifies those outliers and separates them so that we don't consider them as a part of our standard operating costs or our standard profitability analysis. So this reduces a lot of overhead and also makes logical sense to consider only the standard patients as a part of your costs when you compare yourself with the local or international benchmarks. So if I go back here, one step here. So as I said, these are grouped by different types of services which are provided, and you can see these are the number of charge quantities. So as I mentioned earlier, we also have a standard clinical pathway which is given by the local authorities in Middle East, and then we also have international standards which are released by American Medical Association. So we've got these two different benchmarks that we can use to compare ourselves with, and then make sure that our clinical pathway or the type of services that we give for any package is in line with these standards that we have. So there are reports within the application which tells you how much or what kind of match do you have with the local as well as international benchmarks, and what do you need to improve that, right? So those are the important areas which help you to optimize the overall healthcare environment without compromising on the quality of care. That goes without saying. So we don't want to compromise on the quality of care just to reduce our expenses, right? So those are certain important areas that drive our business. Similarly, if I go back to the main dashboard, I also want to do some analysis of information from the cost perspective. As I said, certain services are very expensive, so I want to understand what is inflating those types of services. What are the costs that we can clearly eliminate or do our analysis on. So as you can see here, these are again all different um, services. You can see total procedures by cost. So I can pick up any of the procedure. You can see the volumes, the RVUs, or which are the drivers, and then cost per procedure. So again, this is sample data. We will not pick the numbers against each of these services. So you can see when I selected one of the services and cost per procedure, then it tells me what is the overall breakup. So if you say it is $135, then these are different line items under it. I can go into the details saying that, okay, I want to see why is the payroll cost so high. So when I go down into the details, I can see this is a full breakup of the payroll costs for this particular service. So academic cost, admin cost, I can see the nursing cost is very high, which is around $44. So this should not be the case, right? So I'm saying that this is a type of service which does not need a lot of nursing. So why is the nursing cost so high here? So I can do my analysis this way, trying to figure out, what are the cost leakages. It might so happen that there are your department is overstaffed in terms of nurses, and you're not able to utilize the number of hours or the number of mandates that you have in the nursing department. So it ultimately is inflating your overall costs. So, and obviously impacting your profitability as well. So this gives us a clear indication that, the nursing cost is very high. This is the cost leakage area. This is the area where I want to focus on and reduce my expenses. Similarly, I can focus on other areas as well. So I can see, what are the supplies and pharmacy cost, miscellaneous cost. So I can go into the details of all these different types of breakups, and it helps me to identify if there are any costs which are inflated, or where I can easily pinpoint and reduce those expenses to improve profitability. So the system gives you a separate report which highlights all the inefficiencies, or I would not call it inefficiencies. I would also term it saying that it's not meeting the benchmark or the best practices in terms of the number of hours that you are putting behind in terms of nursing, in terms of the support staff, or in terms of the physician cost. So it gives you those kind of important KPIs right away and helps you to identify the right areas so that you can work on them and improve your overall profitability. So I'm a little conscious of time. I will quickly go back to the presentation and take a couple of minutes to show you how we build this entire cost model. So, as I mentioned, building the cost model is one of the most important areas. So, how do we build the cost model? I'll skip this step. Um, I'll tell you how do we identify what are the right cost pools. How do we break up the entire cost hierarchy into different subgroups so that it's easy for any business analyst or even for a healthcare expert or a doctor or a physician to identify or to analyze the information which is given by the system. So that's how, as we saw, the breakup of all the employee salaries or the administrative costs, the consumables, the maintenance. So we break this, the organization's cost into different cost pools for ease of understanding. Then we also use different drivers to allocate all the expenses. For example, you can see the support services like laundry, procurement, employee services, electricity. So how do I get all these common expenses and allocate it to the direct cost centers or departments. So we have these pre-built drivers which are identified. So we can use these drivers to allocate all the costs from the overhead and the support services to the indirect and the direct cost centers. So when I say direct and indirect, these are support services as well as direct services departments like laboratories, rooms and boards, oncology. These are all my specialties. So once we allocate the cost here, the next is to allocate all the cost from your indirect cost centers to your departments, and then from the departments to the individual services, right? So all these different drivers are identified and kept as a part of our centralized repository, so that we don't have to build anything from scratch. So here, picking up one of the specialties, so we allocate all the costs from radiology to all its services, so that we understand that only specific cost is going to the services, and ultimately we will get the entire detailed report which says the cost per profitability. So I can see a cost per x-ray, similarly a cost per liver transplant, as we saw in the demo. So this helps us to see the cost by patient as well as cost by the service. So that's how we do the step-by-step allocation, as I showed you, from the overhead and indirect departments to direct departments, then to the specialties or the service departments, and then to the patient or the physician level. So this is the kind of cost allocation model that we use, which helps us to drive all our expenses down to the lowest level, and then the system does the analysis for us and helps us to identify the right areas to save our expenses or ultimately improve our profitability. So this is how the overall architecture works. We need a lot of clinical data. We need all the HR related or payroll related information. We need all the uh, cost data as well from different source systems. So we've got pre-built integration adapters available, which integrate with all the standard HI systems like Cerner, Epic, and other ones. And then we integrate with the um, ERP systems, whether it is SAP or Oracle or any other backend solution that you're using. So it's independent of any of these solutions that you've got as a part of your infrastructure. So we extract all this data into our standard repository that we have created, which is more like a plug and play repository. So as and when you start integrating your sources with our repository, you can start doing the analysis immediately. So that saves us a lot of time and effort, because we don't have to build all these structures and KPIs from scratch. This helps us to do the data or the analysis of the cost as well as profitability by service, by physicians, or even by the uh, the patient, as you can see here. So that's it. I've covered all different areas of the presentation as well as the demo. I would be happy to take if you have any questions. I'll also put up a poll question just to help me understand things better in terms of what do you feel, how this can help you to change your organization's perspective towards cost saving as well as improving profitability. So I'll just put up a poll question. Open for another 10 seconds, then I'll close it. So yeah, if you have any questions so far, please let me know. Please type in the chat and we'll be happy to answer them. I have a question about the pre-built integration and the pre-built repository that we have. So um, the question is whether we can use this directly upfront for different types of healthcare related organizations. So yes, my answer is yes. You can use it for clinics. It can be used for, let's say, pharmacies. It can be used for secondary or tertiary healthcare providers. So it's a solution that can be used across different types of healthcare providers, and this helps you to identify overall where which are the areas where you can improve your profitability and save your cost, as well as how you can improve on the quality of care in terms of making sure that the readmission rates or the average length of stay, so those kind of KPIs are accurately met. So it can work for all different types of healthcare providers. So there is another question about if we can use this solution with certain in-house kind of built applications or custom applications. So yes, as I mentioned, this is the integration engine that helps us to extract data from a lot of standard as well as non-standard applications. These can be like your billing systems, which are custom systems made on Java, .NET, or any other solution. So we can integrate with any of your sources or any of your clinical or financial data, and we can get that information within our healthcare repository which is a pre-built repository to get all your KPIs out for reporting as well as for advanced analytics. Anurik, is it possible to unmute someone here because I've got a raised hand?
Sure, I can do that, Arpan.
So we've got Gokul here who has raised his hand. So if you
Uh,
can either unmute him or if he can type his question in the chat.
uh,
Yeah, I have his question. Okay. Yeah, so the question is it possible to integrate to Focus application? I would say yes. It integrates with any and every application because it helps you to extract your data either directly from your database tables, or it can integrate it using certain APIs, or it can also integrate through an interface or staging area. So we have various ways to integrate with the source systems to make sure that there is no human intervention required. So yes, to answer your question, we can integrate with your Focus application. There is another question about people not being available for this activity within the organization. So as a part of our service, we make sure that there is minimum overhead on the organization's team. So in terms of our finance or your healthcare teams, we don't want them to divert their focus. We want them to do their regular business as they are doing, and we will step in to do any type of consulting or data prep. So let me give you a quick example. So in a lot of cases, we've seen that organizations, they did not have a standard operating model wherein they could capture the drivers. Let's say um, the RVUs. So they were not following any international standard RVUs. So, and they wanted to have their own RVUs. RVUs are basically your drivers, right? So it defines the complexity of the services that you provide. So so those weightages. So we prepared those weightages for them from scratch as a custom. So these are now standard for this organization themselves. So we do this using our healthcare experts within the organization and as well as our cost accounting department. So we created these drivers based on their request for their specific need, and we are now using this custom drivers or custom weightages to do all the cost allocation. There's another question about can we customize the requirement? Absolutely. So the platform is very flexible. Why we have created a pre-built environment is just to make sure that everyone gets a kickstart. They don't have to reinvent the wheel. But for sure, you can customize or modify the cost allocation engine or your KPIs or the reports the way you want to. So it's a very flexible system. You can have your own self-service dashboards as well, wherein you can create your reports and analysis by just quickly dragging and dropping. The other question is about if we support Epic or not as an EMR. So yes, we have integrated with Epic in a lot of our customer places, and we have got ready-made integrations with Epic. So I can also share certain names with you. For example, Adventist Healthcare. So Adventist Healthcare is using Epic, and we have integrated with Epic to get all the clinical information from there to fuse it with the financial information to give us our KPIs. So we have published Adventist Healthcare's video as well on YouTube. So if you look for Adventist Healthcare EVOSys, you will definitely get that. So it's completely built on Oracle technology.
yes, we do have a question, Arpan.
Yeah. Okay. Do we have existing integration integrated ERP for medical distribution organization? Yes, we've got a number of clients in this line of business, and we can offer you or we can showcase you use cases or case studies wherein we have implemented these solutions for these kind of organizations where they're you know more like distributors. So we can get in touch with you, Gokul, and we will show you the kind of use cases that we've implemented for these organizations. That will give you more clarity. So a last poll from my side. I know we are just beyond time, so a very quick one about. So we are also planning to offer like an assessment, or I would say an interaction with your teams, so that you can get a clear roadmap as to what can be done within your organization for these kind of solutions. So again, as I said, it's not just limited to profitability or costing. It's also expands to a lot of different areas, like how do you optimize your supply chain, how do you optimize your financials, how do you optimize the performance of your staff or your workforce. So it's a very broad area, but we can definitely help you to understand the roadmap and how you can achieve that roadmap. So I'm just launching a poll. You can let us know. You can use the poll to express your interest, and we'll get back to you on this. So we do have offices in Bahrain, as well as in Saudi, in UAE, Oman. So we are present in almost all the Middle East countries, as well as in other parts of the globe. So I'll share the contact details. Okay, thank you so much. I think these are all the questions that we've got. I would like to thank you for attending the webinar today, and we will get back to you, and we'll share more case studies with you so that we can see how we can build a good roadmap for you on this solution. Thank you. Have a nice day.